But can a child who has escaped all these things suddenly at 5 years of age begin to show symptoms of cerebral palsy?
It does depend. Sometimes some people say that some of the autistic children we see, children who suffer from autism, or children who have hyperkinetic disorders, attention deficit, may have suffered some form of undiagnosed brain damage, even though you did not find them having posture and motor disorders. But some of these may be the manifestations, the later manifestations of this condition.
But can posture and motor disorders start later in childhood, like say 5 years old?
Well, they should be. They may be. But what I would say is that we usually would expect them to have manifested much earlier.
Much earlier.
All right? You also have to remember things like in the early neonatal period, jaundice. Jaundice is the abnormal or excessive coloration of the sclera, the yellowish tinge to the sclera. The sclera is the white part of the eye, separate from the... So you have the sclera and other mucous membranes, that's the mouth, the limbs, and even the palms and soles when it's so severe. This yellowish tinge is the result of excessive bilirubin, which is a pigment that we find a lot in the red blood cells. As a child grows older, the quantity of red blood cells he needs for a normal physiologic activity is much less than what was needed while he was in his mother's womb.
Okay.
So that there's a breakdown. And this breakdown can give rise to an excessive quantity of bilirubin in his blood. So usually the pediatricians will say, if you find jaundice in a child the first day of his life, it is pathological.
Okay.
Because you expect that physiological jaundice should happen a few days after birth.
Okay, so doctors should, what can they do at that point?
Once you find a child having yellow eyes at birth, be sure to take him to the hospital and be seen to have done something. You see, it depends on the level of bilirubin. We manage these things at various levels. Just bright sunlight, or what we call ultraviolet radiation, can sometimes be used in treating jaundice. But at the severe levels, there is a need for what we call exchange blood transfusion, where you have to draw out a certain amount of blood and replace it with an amount of blood just to dilute the child's blood.
And this could help in preventing cerebral palsy.
It can help.
You were also talking about neonatal supervision. Is this one of the preventive methods?
Oh, yes. You see, the thing is, if there's any message we want to pass across today, that supervision of children, even while they're in their mother's womb, that means at antenatal level, when they are born, that is at the delivery level, and even in their very first few years of life, or few months of life, is most crucial, because any infection, inflammation, any damage, any drug, there is any abnormality in their physiological function at that point can damage the brain.
We are handling cerebral palsy on Health Matters, and this is the time that you can call in with your questions and your comments. The number to call is 0808 054 2233. That's 0808 054 2233. And you can also tweet at me if it comes in early enough. It might be read on the show. Now we're talking about prevention.
That's right.
And this neonatal, antenatal supervision seems to be very important. But what can someone actually prevent? Is it prevention of infection to the mother, trauma, or what?
Okay, so let's talk about prevention in terms of education of the populace, first of all. And the people have to appreciate the fact that, you know, the mother carrying the baby puts the baby at risk of this condition if certain things are not put in place. So we've talked about Torch's group of viruses. There are vaccinations for them. Okay. There is a mumps, rubella, you know, mumps, measles, and rubella vaccine. There is a vaccine you can have offer the mother to, just so that she doesn't develop a child who's going to have complications. The thing is, prematurity, for instance, is one of the risk factors for cerebral palsy.
But that can't be helped, can it?
Well, it can't be helped, but it can be helped in the sense that you can have adequate neonatal care services. You can have premature, you know, incubators and well-trained neonatal neonatologists to be able to help a woman who definitely has to deliver that baby. When a woman has severe hypertension in pregnancy or some other conditions that make her at risk of, you know, some other complications by having the baby within her, and operative delivery has to be instituted at much earlier than the gestational age, that child definitely has to be cared for. Prematurity puts them at risk of severe infections. Their livers are not mature enough. You know, there are so many issues with temperature regulation and how to, you know, combat infection and things. Therefore, in the incubator and under the supervised care of specialists, they are, capable of having a good chance of a normal life.
But what do you do with infections that come as a result of mechanical handling of a child who has to be delivered by forceps or something like that?
Again, that would have to mean that it has to be done with the competent hands. We can only prevent these things. That is not to say they don't happen, but you can easily reduce the rate at which from your statistics, the incidence of cerebral palsy or the prevalence of cerebral palsy in this part of the world can be up to 5 to 8,000.
Yeah, that was a global figure.
700,000 children. 700 persons are living with cerebral palsy. That was a statement made by.
Where is that?
That's in Nigeria. You have in Ogun State, that's OOU, that's Ogun State University Teaching Hospital, Olabisi Onabanjo University Teaching Hospital. A study there done by Ogunlesi et al. They found cerebral palsy accounting for more than 50% of the new cases that come to their pediatric neurology.
50%?
That's
and people hardly talk about these things here.
In this part of the world where we do not have access to healthcare, where there is a lot of beliefs in traditional methods, there is what you call delays at various levels in the search for care.
Okay, let's hold it there for a moment. A call is coming in. Hello, Olatunde. Is this Olatunde? Hello. It doesn't look like we've really got through to Olatunde, but please do continue trying. Okay,
so you're talking about levels of care. So a woman knows that she has a problem in terms of labor. The first problem is delay at trying to seek care. So there is this home remedy you want to believe in. There are various things that stop you from believing that you need to go and look for care hospital where it's available. When you get to the hospital, there are various delays too. All right, and even in the course of trying to effect treatment for the patient, there are various delays. These are the things that cause antenatal care to be impaired and give rise to children who have problems, either neurological or non-neurological problems. But that's why the statistics.
So there must be no break in the link.
There must be no break, no break. And even those who wish to offer care at the maternal or antenatal level, who are non-orthodox practitioners, must also endeavor to know when danger signs begin to show.
Okay, now we have a call coming in. Right after that, we must go to management.
All right.
Hello.
Hello. Good morning.
Please, good morning. Please, let's have your question or contribution.
First, thank you for bringing up the issue of cerebral palsy to the public.
You're welcome. Please go ahead.
Yeah, it's a good thing that the doctor is talking about this, because one of the things he mentioned is that parents are still in denial of the fact that their children have BP.
Okay. Hello, are you still there?
Yeah, I'm here.
Okay.
The second thing is, especially for those parents who have been diagnosed, whose children have been diagnosed, it is important, especially for parents who have been diagnosed, it's important to know that this is not a condemnation. There are simple, physically tested methods that can be used to support the child.
Okay, and we are going.
While you might not be able to overcome the condition completely, you can build on the child's cognitive capacity.
Thank you so much, Ben.